Well, good afternoon, everybody. Welcome to our webinar today about funding reform. My name's Nick Hartland. I'm a officer in the Department of Health. I look after a division that runs, among other things, residential aged care funding, and I'm going to be the chair cum host of this webinar for you today, and you'll hear from me a couple of times when I introduce participants and ask some questions that you submit. The first thing I'd like to do is acknowledge the traditional owners and custodians of the lands on which we are meeting today and pay my respects to elders past, present and emerging. And I'd also like to extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander peoples that are with us today on the webinar. Today I'm going to be joined by three colleagues. Mark Richardson, who'll do a presentation for you on the ANACC. Jess Evans from Structural Adjustment Strategy, who'll talk to you about reporting, and Angela Tolk from Services Australia, who'll talk to you about some of the changes they're making. I'm also very happy that we've got Sue and Rhonda, who are Auslan interpreters, that are joining us for this session. Now, this is the fourth in a series of webinars on funding reform, and it deals with what's one of the most important topics to the sector of ANACC funding. We're acutely aware that people are wanting more information about that, and this is one step in that direction. We'll also look at quarterly reporting requirements and the changes that Services Australia are making to their payment system for residential aged care, what's affectionately known as SPARC. It's really important to us that that we communicate to you about what's happening, but we also really value the questions that we hear from the audience. It's a great opportunity for us to get an understanding about what you're concerned about and to address concerns if we can. So please use the Q&A functions to submit questions to us. You'll find that on the bottom right of your screen, and you can just simply type the questions in. There are a lot of people registered for this session, so while we encourage you to submit as many questions as you can, please understand that it may get to a situation where we can't answer every question. If that happens, then we'll certainly go through the questions and develop sort of some structured communication products that respond to them. But it might be the case that we can't get to every question this seminar. And in fact, we're hoping that you ask so many questions that we can't in a way. So you'll just need to bear with us if that happens. And finally, just before we go, I'd just like to remind you that there are a number of ways you can keep in touch with the aged care reform. So they were just up on your screen. I won't read through them again, but please keep in touch with us so you can get access to information and further webinars. So I think at that point, we should get on with the slideshow because there's a lot to get through today. These are all three very important topics. And so I'd now like to introduce Mark Richardson, who will talk to you about the Australian National Aged Care Classification System.
Thanks, Nick, and thank you all for participating in today's webinar. The purpose of my presentation is to provide you with key updates on the implementation of AN-ACC, particularly an update on shadow assessments, including our findings regarding quality assurance, how the AN-ACC care funding model works. I will step through some examples on how to calculate your funding. I know you're all interested to know more about care minutes, so similar to the funding model, I'll step you through the allocation model and an example of how it will work. And lastly, what support will be available to help you transition to AN-ACC. Next slide, please. I'll now step you through our progress with our shadow assessment related activities. Next slide. To prepare for the transition to the new AN-ACC care funding model, independent assessors are conducting shadow assessments with all aged care residents to determine AN-ACC classifications that reflect their care needs. The outcome of the assessments will determine the variable component of AN-ACC funding, which I'll go through in some detail in later slides. There are 6 independent assessment management organisations with over 300 assessors located around Australia to conduct assessments. So far, over 146,000 AN-ACC classifications have been assigned, over 4,600 AN-ACC respite classifications have been assigned, and over 700 providers have had at least one facility assessed. That is just over 2,100 facilities out of around 2,500 facilities. COVID-19 continues to cause major difficulties with assessor access to facilities and has slowed our progress down. However, we believe, albeit that we cannot control what happens with COVID, that we will have completed all shadow assessments well before AN-ACC go-live date on 1 October 2022. I encourage providers to work with the independent assessors to conduct assessments in your facility during the shadow assessment period to ensure all assessments are completed well before the implementation of AN-ACC. Next slide, please. The department has engaged an independent organisation, Taylor Fry, to develop a statistical data tool to analyse AN-ACC shadow assessment data and validate outcomes, and to conduct analysis and report on the outcomes of the dual assessment checks, where two assessors independently assess the same resident. This quality assurance analysis ensures that independent resident assessments are high quality and consistent, resulting in accurate, reliable and consistent case mix outcomes. Each week, the department provides updated de-identified shadow assessment data to Taylor Fry for analysis. Taylor Fry provide a weekly report to the department highlighting anomalies. The department investigates the anomalies and takes action as required. Highlighted anomalies are a material statistical difference between expected and actual results. They are not a flag for incorrect assessments. They flag results that are different from what was expected and require further investigation. So far, only 4 assessors have been found to show inconsistent results, and importantly, our dual assessment results show a 90% consistency of assessment outcomes. Dual assessment checks are where 2 independent assessors undertake an assessment of the same resident at the same time with the results of the assessment compared. 90% is an extremely good result for human assessments, with 70% being the standard for most industries, and shows that our assessments are reliable and consistent. I know that AN-ACC will impact your funding. How AN-ACC will impact your funding is of great interest to you. As a result, I'll now step you through the calculations, how the calculations will work. The AN-ACC Basic Subsidy funding will roll together the existing basic subsidy, that is ACFI funding, the amounts currently provided through the Basic Daily Fee Supplement, the Homeless Supplement and the Viability Supplement, and the additional funding for care minutes that commences from 1 October 2022. The AN-ACC care funding model will provide a more equitable funding outcome for providers that better matches resident needs with the costs of delivering care. Supplements such as oxygen, enteral feeding, veterans and accommodation supplements will continue to be available to eligible providers and will be paid separate to AN-ACC funding. The AN-ACC funding model consists of 3 separate components. A fixed component or base care tariff reflecting the characteristics of the facility, i.e. region in which the facility is located and associated delivery costs. These are costs that are generally characteristic of the same or fixed for all residents within a facility, such as infection control, maintenance of the clinical records and managing supplies. A variable component reflecting the case mix classification or AN-ACC class of residents determined by an AN-ACC assessment of a person's care needs, and a one-off adjustment payment for new residents. This is to cover the extra costs associated with transitioning a resident into a facility. The variable and fixed components each make up around 50% of funding. The one-off adjustment payment is a small component of the overall funding. The National Weighted Activity Units, or NWALs, that are to be applied in AN-ACC are relative values that determine the amount paid for each funding component, with an NWAL 1 being a single measure of price that represents the standard day of care. This allows payments to be weighted to reflect the variation in the costs of providing care due to the different individual care needs of residents and different structural characteristics of care homes. The base care tariff table on the left of screen covers costs that are considered fixed as they do not change significantly with changes in individual resident care need or with small changes in occupancy. For example, the costs of a night supervisor are fixed and are determined by the overall number of residents rather than the needs of a specific resident. For the base care tariff component, the NWOW recognises that remote facilities in M 6 and 7 and specialised homeless facilities tend to have higher fixed costs. Therefore, the NWOWs for these facilities are weighted higher to reflect the higher cost of delivering care. In addition, for these facilities, funding will apply for all approved beds in recognition of the often low and/or variable occupancy levels experienced by remote facilities. I will walk through an example of how to calculate funding for these facilities later on in this presentation. So, if the price for an NWOW 1 was set at the current ACFI rates, the base care tariffs provide a significant funding boost to remote, specialist, homeless and Indigenous facilities. In the second table on the right, you see the different weightings attributed to each of the 13 AN-ACC classes of care. The classes requiring more intensive care are weighted with the highest NWOW. You can also see at the bottom of the slide that the one-off adjustment payment for new residents entering a facility has an NWOW set at 5.28. Also referred to in the previous slide, this is to cover the extra costs associated with transitioning a resident into a facility. The scenarios on this slide and the ones to follow are provided to illustrate the effect of AN-ACC for different types of facilities and for residents with different care needs. They are examples only and should not be taken literally in terms of the funding that will be provided to support care. Imagine that the government price for an NWOW 1 or the AN-ACC price is $10 per day. Using this price, the following funding would be payable. In regards to John, who is a resident in a very remote facility with Indigenous specialisation and has an assessment classification of 13, his base care tariff NWOW would be 1.8 and his classification NWOW would be 1. To calculate the total funding the facility would receive for John, we would firstly work out the base care tariff funding by multiplying the NWOW 1.8 by the price of $10 to arrive at $18 a day. Secondly, work out the classification funding by multiplying the NWOW of 1 by $10 to arrive at $10 a day. And thirdly, add the base care tariff and classification funding together to get a total funding amount of $28 a day for John. In regards to Hazel, we would follow the same process. So, in this example, we are determining the facility level funding. In this case, we have a non-specialist, non-remote facility with a base care tariff NWOW of 0.49 and 2 residents, Andrew and Rob, with a classification of 5 and 3 respectively, or a classification NWOW of 0.37 and 0.31. Using the same calculation methodology, which I outlined during the previous slide, the total funding the facility would receive is $16.60 per occupied bed per day. We simply add Andrew and Rob's funding together. In this example, we have a 3 approved bed specialist Indigenous facility in a remote location with a base care tariff NWOW of 0.78 and 2 residents, Margaret and Daisy, with a classification of 8 and 11 respectively, or a classification NWOW of 0.54 and 0.83. The 3rd bed is vacant. As this is a remote facility, the base care tariff payment calculation applies to all approved beds in recognition of the higher fixed costs and often low and/or variable occupancy levels experienced by remote facilities. As such, the facility's total funding for one day is $29.30 for the 2 occupied beds, plus $7.80 for the vacant bed, which when added together is $37.10 per day for the facility. I should note that approved beds exclude any provisionally allocated places that are not yet ready to use to provide care to residents. The Transition Fund will provide up to $53.3 million over 2 years from the 1st of October 2022 to provide assistance for eligible residential aged care providers to transition to the AN-ACC funding model. The eligibility criteria for the AN-ACC Transition Fund will be determined following the completion of AN-ACC assessments in June 2022. The Department will communicate when the AN-ACC Transition Fund will open for applications once shadow assessments are complete. In response to the Royal Commission Recommendation 86, the 2021-22 budget included $3.9 billion to enable residential aged care providers to meet a new case mix adjusted average minimum care standard of 200 minutes per resident per day, including 40 minutes of registered nurse time. It is important to note that this is an average across the sector, that each facility will have their own care minute target based on their resident case mix. Consistent with the Royal Commission recommendations, the average case mix adjusted 200 minutes standard includes personal care workers, enrolled nurses and registered nurses' time, and is to include a minimum of an average of 40 minutes of registered nurse time per resident per day. There will also be a requirement across facilities to have a registered nurse on site 16 hours per day. A facility's care minute target will be adjusted according to the combined AN-ACC classifications or case mix of the residents at the facility. In practice, this means that facilities with a low case mix will be required to deliver less than 200 minutes, and for facilities with a high case mix, they will be required to deliver more. Since October 2021, providers were required to report in their annual financial report staffing minutes per facility, moving to quarterly reporting from 1 October 2022. We are aware residential aged care providers are concerned about the ability to recruit and retain sufficiently skilled workers to meet the new care minutes requirements. The care minutes requirements will be mandatory from 1 October 2023. This is in recognition that it may take some time for providers to attract and retain sufficient staff to be able to achieve the care minute targets. Study 1 of the Resource Utilisation and Classification Study, or RUCS, involved a service utilisation or staff time data collection that found that close to 50% of staff time was spent delivering care tailored to the specific needs of the resident, while the remaining 50% was spent delivering shared care across all residents. In recognition of this, the case mix adjusted care time is calculated using 50% of the base care tariff and 50% of the AN-ACC classification. The base care tariff component will be derived using the base care tariff so that specialised or remote facilities will not need to deliver more care minutes than metropolitan facilities, all else being equal. For the AN-ACC classification, the minutes allocations are based on what was found to be delivered in the relativities in the RUCS study. As you can see, it is proposed that residents within Class 1 and those with higher AN-ACC classifications and therefore higher care needs will trigger more minutes towards the facility's average targets. It is important to note that the case mix adjusted care minute standard for the total 200 minutes and the 40 minutes of registered nurse time will be determined and assessed at the facility level, based on the average total resident case mix for each facility and not for the resident at a facility. This slide demonstrates how care minute targets are calculated using example residents Mary, Fred and Martha. Each of these residents have different care minute requirements based on their AN-ACC classification. The care minute targets are determined by calculating the sum of the residents' care minutes divided by the sum of the residents' number of days in care. We have calculated the total number of care minutes and registered nurse minutes for the three residents as 43,530 and 9,210 respectively, based on their AN-ACC class and the length of time they were at the facility during the quarter. We then divide this by 210 days, which is the total number of days for all three residents, to get a care minute target of 207 minutes and 44 registered nurse minutes for this facility's resident cohort. I should clearly point out that the requirement is to deliver an average of 207 minutes, not that each resident receives 207 minutes. It should also be noted that there is no minutes requirements associated with a new entry, even though there is a one-off payment every time a resident enters care. And finally, I'd like to open up and answer any questions you might have, but before we do, I'll quickly outline how we plan to support the sector during transition. Once government releases the AN-ACC price and assessment data, we plan to establish an online estimator to help you with the calculations I went through today. Establish a help desk along with a targeted outbound support to those providers that may require more assistance. A series of fact sheets about AN-ACC, including how to make the estimations I went through, and a virtual roadshow about AN-ACC. Questions?
All right, thank you very much, Mark. So we do have a bit of time for questions before we need to go to Jess. Firstly, there's a couple of people asked about whether the slides will be distributed, and yes, we will make them available on our website, so you can look at them slowly and also have a chance to read the fine print. So there's a couple of questions I'll just pose to Mark that have come off the board. There are quite a lot of questions, so we won't be able to get through all of them now. Mark, Emil asks, when will the ANAC shadow assessment results be released to providers?
Look, that's a good question. At the end of the day, that's a government decision. One would expect that price and assessment information would be released at about the same time. You need both components in order to determine your funding. But I guess, once again, that is a government decision. So I can't advise today, unfortunately, when that will occur.
Okay. I think we can say that we're expecting the government to announce the plans for it very soon. But that Mark's right. Me and Mark need to not get too in front of our political masters. Andrew asked, are facilities going to be revisited so new residents who enter care after the shadow assessments are also assessed?
So look, there's something called reclassifications. Once again, once assessment information becomes available, facilities or providers will be able to request a reclassification. There are some boundaries around that, such as, for example, for different types of classes, there's a time period in which you would have to meet before a reclassification can be requested. So I guess, in essence, the answer to your question is yes, there will be time available for facilities to request a reclassification.
Thank you very much. Nicole was asking, have the ANACC fees been circulated?
No. So the fees are dependent upon price. So I guess a fee per class would be an NWOW times price. So as we, I guess, just discussed, that requires government to release a price first.
Yep. Carla was asking about allied health, and her question was, how will the government ensure that allied health needs are met? And she notes that the minimum care requirements from the Royal Commission didn't specifically address allied health.
Yeah, look, that's a really good question. So you're right. I guess what we're implementing is consistent with the Royal Commission in terms of the professions that are included in the 200 minutes. Allied health, I think it's important to note that existing legislation under the Aged Care Act, under the quality standards, requires facilities or providers to deliver allied health care consistent with care plans. And secondly, as I went through, ANAC will include existing ACFI funding. That ACFI funding includes allied health. So the funding is available, and the legislation requires providers to continue to provide allied health services to residents. Lastly, I'd add to that is that we are collecting information through the ACFR report on the number or the care minutes associated with allied health. So we'll be actively monitoring what's going on in the sector, and that will inform future policy decisions in that space.
Thanks, Mark. Now, where are we? Anna has asked, where is the classification done? Is it before or after a resident is admitted?
No, it's done when a resident is admitted. So generally we try to do that reasonably quickly. So yes, when a resident's in care, that's an important part of the assessment process.
Cool. Now, Cameron has a couple of questions, and although I am unfortunately assuming that it's one Cameron and not two, so apologies if there are two Camerons out there. So the first was 50% of our residents will not have a classification before October 2022, and will ACFI be grandparented?
So look, I don't know where the 50% comes from. As I mentioned in, I guess in the presentation, we're planning to have all assessments completed by the end of June 2022. well before the 1st of October. Once again, the caveat there is COVID-19 and what happens in that space. We have been held up due to COVID. Will ACFI be grandparented? We do have a transition fund. Maybe that goes to the heart of the question. So the transition fund, as I mentioned, is a $53.3 million fund to help providers move from ACFI to AN-ACC. Once all the assessments are completed at the end of June, we'll be looking to set some eligibility criteria for that, and we'll open up applications to the sector.
So an individual ACFI classification for a person won't be grandparented, just to go look at that question from the other side. So that from 1 October, everybody will be paid, every resident will be paid on their AN-ACC classification, but we will look to the impact of any changeover for providers.
Correct. Yep.
All right. So Kira was asking, will these assessments all be conducted by external assessors?
Yes, they will. They're independent assessments. So facilities or providers will no longer be required to undertake assessments themselves as they do under ACFI. We think that's an important part of the model, having independent assessment. Once again, as I outlined during the presentation, we're doing a lot of quality assurance on those independent assessments. I think the key thing is that the dual assessment process has shown that 90% of the time we're ending up with the same classification result. And once again, that's extremely good when it comes to, I guess, human assessments, and exceeds similar industry standards, which are about 70% for those types of assessment processes.
Yep. Thanks, Mark. Monica was asking, will ACFI reviews continue?
That's a good question. Once we switch, look, I might be slightly wrong here. We're switching over to AN-ACC, so I guess at a higher level, no, ACFI reviews won't continue, but there will be a time period. I'm not exactly sure what that period is. ACFI is not in my area for, I think, facilities to make adjustments to some of the ACFI classifications, just as I think there is that facility to do so now. So there'll be a small transition period for those types of adjustments.
Okay, thanks very much. All right, so everybody who's still submitting questions, thank you very much. There isn't a longer period for and thank you very much, Mark, for the presentation and those questions answered. There will be a longer period for questions at the end of it, but right now, I think just to keep us on time, I'd like to ask Jess Evans to give her presentation.
Hi, Nick, and hi, everyone. It's nice to be back at the webinar. I spoke at the last aged care funding reform webinar held in December and provided information on the financial and prudential monitoring, compliance and intervention framework. And a key part of this framework is the introduction of quarterly financial reporting requirements, which will come into effect from July this year. So for overall, the quarterly financial report will provide timely analysis or timely information which will enable analysis of the sector's financial performance. It will also provide information that will flow through to the new star rating system. It'll enable the department to plan and develop policy using up-to-date data and also help to inform the AN-ACC pricing model. In addition, we are working with the sector and talking about how the information collected can be provided back to the sector to provide information, including benchmarking and best practice information. So they're the objectives of the quarterly financial report. Since our webinar in December, we have been consulting on the template for the quarterly financial report, which I'll go through today. We met with CFOs and financial managers from around 50 residential and home care providers to provide information about the report, but to also understand any challenges associated with the introduction of the reporting requirements. I'll now go through a bit of an overview on what will be collected in the report. So if you wanted to flip to the next slide. The first part of the quarterly financial report covers viability and prudential compliance questions. These provide forward-looking indicators to identify providers who may have financial concerns. Early identification will allow the department to proactively engage and support providers to improve their financial performance. Go to the next slide, please. This is the home care providers questions, and if we move through to the next slide, we'll show part 2 of the report. Part 2 of the quarterly financial report is the quarterly financial statements. This includes an income statement and balance sheet at the provider level, and as you can see, it is segmented into residential, home, community, retirement living, and other categories. If we move through to the next slide. Part 3 of the quarterly financial report is concerned with the residential care labour costs and hours. So this is what Mark was just speaking about earlier, and this provides information at the facility level about the direct care related labour expenses and hours, and it's broken down into care types, including registered nurses, enrolled nurses, personal care workers, and as you can see, allied health is captured there too. And this is similar to the information that was collected in the most recent aged care financial report. We move through, so this one provides information on residential care. If we move to the next slide, this is similar information but for home care providers. So part 4 of the quarterly financial report is home care, labour costs and hours, and it collects information on direct care costs and hours for those delivering home care broken down by similar care categories, and it will be collected at the aged care planning region, similar to the aged care financial report. We move through to the next slide. Thank you. This is the final part of the quarterly financial report, and it is the Food and Nutrition Financial Report, which has been the requirement to receive the 2021 basic daily fee, which is being rolled into the AN-ACC funding model from October this year. So this is similar to the information that has been collected through the food and nutrition reporting, but going forward will be rolled into the quarterly financial report. Thank you. So in terms of consultation sessions we've been doing with the sector, we have received feedback on a few key areas. These relate to the timing of the report submission, the usability, how providers upload the information and how to make that as easy as possible, as well as some questions around technical definitions. So we're working now to consolidate this feedback and consider adjustments, and we'll provide the final report in the coming weeks. I do want to say in regards to timing for the quarterly report, the first report will cover the first quarter for the 2022-23 financial year, and it had been proposed that report be provided by 21 October. We've heard from providers that this timing may be challenging, and we're working through to look at other reporting requirements, and we will advise on the reporting requirements at the same time that we put out the final report. Another question that has been asked relates to sign-off and auditing and accountability. The quarterly financial report will not need to be audited. However, similar to the annual report, there will be some accountability requirements, including signature by key personnel. Once the report is released, it will go out through our newsletter. It will be available online, and we'll also offer or develop detailed definitions and user guides. And we'll run some training sessions that are helping providers to understand the definitions, the technical aspects, and help them to implement these reporting requirements. So that's an overview of the quarterly financial report that will be introduced from July this year, covering the first financial quarter. And these changes to financial reporting are key to the recommendations from the Royal Commission, which go to greater oversight and transparency of aged care providers. In addition to the quarterly reporting requirements, as part of the broader transparency measures, We're looking to require each residential aged care provider who currently prepares a general purpose financial statement to publish that general purpose financial statement within 5 months of the provider's financial year. This statement would be published on their website, or if the provider doesn't have a website, then the statement should be published on a website that is publicly accessible. This will give the provider 1 month to publish the general purpose financial report after the submission of the aged care financial report. The requirement will start for the period of 1 July 2021 to 30 June 2022 and continue with each general purpose financial report thereafter. So that's the information I wanted to cover today. As I said, the detailed template for the quarterly financial report will be submitted in the coming weeks, along with the advice around the timeframes. There'll be a number of training opportunities and detailed webinars to take you through the technical aspects of this reporting requirement. And I'm happy to take any questions, and thank you for joining the webinar to listen to the information that we're taking you through today.
So thanks very much, Jess. Yes, there are some questions that we'll ask you to have a quick look at. So Nicole asked, when are we likely to see the final report? She noted that there's significant work required to set up systems to produce the numbers and to submit them with a short turnaround for lodgement, and it would be beneficial to start preparing as soon as possible.
Thanks, Nicole. The final report is very much reflects the information that was captured in those templates that we just worked through. So that will be circulated as part of the slides, and providers will be able to have access to that. The detailed template and guidance material and definitions I'm expecting will be released by the end of this month.
Thanks. And I think that answers Alex's question, but I'll just confirm it. Because that was, is there an example of a new CFR report somewhere? And I think
and just to clarify, Alex, so the aged care financial report will remain. It includes additional information that is submitted, like reconciliation statements. So that will remain in place. We're looking, once we've gone through the first year of quarterly financial reports, to consolidate some of that reporting so you're not providing it through multiple channels. But the information we've just gone through today is for the quarterly financial report, and the templates that were up on screen reflect the information that will be collected.
So Kim asks, will the reports be finalised before 30 June so I can ensure that our chart of accounts matches the department's requirements and definitions?
Yes, that is correct. As I said, hopeful for the end of this month.
Thanks, Jess. When you say that the report has to be signed by key personnel, do you mean the director?
I do. I mean the director. It's the same requirements as the aged care financial report. Thank you.
Thanks, Jess, for clarifying. Jane, you might have dealt with this, but I'll just clarify. Jane was asking, when can we expect to see guidance for home care providers on ACFR?
Oh, okay. Thanks, Jane. This information, this template did include 2 aspects for home care providers. So there was a slide that had the home care provider labour costs and hours for home care providers, and the income and balance sheet statements would also apply to home care providers. So if once this pack is circulated, the detail will be captured in those slides as I talked through.
Thanks. Sinead asked, what period is to report it on the 21st of October? Is that for July to September 21?
That's correct. 22, yes, correct. So this financial year will be July, August, September of 2022, right? Yeah, and this report will be due after that, so kind of October onwards after that.
Okay, thanks. Madeline asked whether the quarterly reporting requirements apply to CHSP providers.
No, they do not.
All right. So, look, I think, again, there'll be chances for people to reflect on this and ask additional questions. we'll also go through the questions you've asked to see if there are any that we need to get to at the end of the period. But just to keep us on time again, I'll now ask our next speaker, Angela Tolk from Services Australia, to talk to us about the system for payments of aged care residential payments.
Thank you so much, Nick. Good afternoon, everybody. My name is Angela Tolk and I'm the Assistant Director for Residential Aged Care Funding Reform Program at Services Australia. This funding reform for residential aged care is a critical and significant program for us at Services Australia. So supporting older Australians and especially those in residential care facilities is an important priority for the Australian Department of Health and Services Australia. In 2020 alone, Services Australia processed over 33,000 claims for residential care, and we know that this number is growing as the Australian population ages. So we've got two milestones to our delivery of the program. The first is the replacement of our internal payment system, which will ensure that Services Australia is ready to support the upcoming funding assessment model changes. And the second is the actual implementation of the new AN-ACC funding model. So for milestone 1, Services Australia will first upgrade its payment system in June 2022. So we're working to deliver a modern digital end-to-end capability that will offer more functionality for services on the aged care provider portal. These changes will primarily be internal changes and focused on how Services Australia manages claims and processes payments. So while the impact of this upgrade will be minimal for providers, there will be changes to the aged care provider portal and to the payment statements as a result of the upgrade. The key change will be how payment statements are presented. So Services Australia will publish education material closer to the date that will help services read and reconcile their new payment statements. The change in payment statements does mean that software developers will need to update their software. The sample files for the updated payment statement are now available on the Services Australia website, and we've got a link at the bottom of the slide, so we'll display that shortly. If you are a software developer, please download the sample files and prepare for the appropriate updates. Our second milestones will be implemented on the 1st of October 2022, when AN-ACC, so the Australian National Aged Care Classification, which replaces the ACFI, which is the Aged Care Funding Instrument, that will actually happen on the 1st of October 2022. So the new funding model will apply to every care recipient in permanent care and residential respite care. In the lead up to the funding model changes, entry requirements for palliative care recipients will change in July 2022. So while there'll be no initial impact on payments, changes are being implemented earlier to ensure that care recipients start receiving the correct payments as soon as the funding assessment model changes in October. So this phase will result in changes to claiming arrangements and payments made to providers and the aged care provider portal. So in addition to support and engagement from Australian Department of Health, Services Australia will run webinars and publish education material closer to the date to help services understand the claiming and payment statement changes. For software developers, these changes will require updates. So there's a lot of moving parts to this program, and the team are working hard to ensure that we will be ready in time for you and your care recipients. At Services Australia, these changes are about improving the quality of care that older Australians receive through some fundamental changes to funding, as well as modernising the payment platform to enable these payments to be made. So we've got a list of contacts, some important resources for software developers and also providers. These are also available on our website, and we will be publishing the links to the actual pages through other education material as we progress through our transition. Thank you, everybody, and now I'd like to pass back to Nick for questions.
Okay, thank you very much, Angela. So we'll just have a couple of questions focused on Angela's presentation, and then we'll invite the other two people back and have a group session. So Angela, just first up, are the changes coming up in June compulsory?
So the system replacement changes will impact the payment statements, fields that are inside of them and how they're presented. So if the changes aren't implemented, then providers will not be able to receive all of the information and they may not be able to reconcile their payments correctly. So we really highly recommend that these changes are implemented.
What date in April will the APIs for ANACC be released?
Yeah, so the APIs are currently being really vigorously tested. So we don't have an exact date as yet. However, we will be communicating with software developers on a regular basis. And if you are a software developer, I really recommend that you sign up to the Health Systems Developer Portal. That will be one of the primary areas for communication. And we will notify the developers registered in that portal when the files are available.
Right, cool. And how the system upgrade changes in June affect me as a provider?
Okay, so the changes in June will primarily be internal. So the impact of the upgrade will be minimal for providers. There will be some changes to some of the screens in the aged care provider portal and the way that the payment statement looks. So they're probably the most important ones. So you will need to make changes to the way that you reconcile your payments. So we will have all the education material and resources in our gateway, which is linked through our website, and that will support providers in this.
So this might be one you have to take on notice, but it's come from the floor. From Helena, will developers have to go through the notice of integration testing for the new PAIs?
So notice of integration will be required for the October upgrade, so the APIs that will be released in April, but it will not be required for the June release. So it won't be required for the payment statement changes. All the sample files for payment statement changes are already up on our website, and we will have the link available for everybody. I think the slide actually has gone, but yes, so when these are dispensed out to everybody, there'll be the link available that they can go to our website for all of the June changes. So yes to NOE for October, no for June.
Okay, great. All right, so I think at this point we might ask Jess and Mark back into the webinar. You hang on there as well, Angela, and we'll go to questions across the three. So where are we? All right, so I think a lot of these will be ANACC, but I'll hopefully be able to pull out some more for Jess and Angela as well. So Mark, will the fixed and variable NWAL multipliers be updated going forward? This is from May.
Yeah, look, that's a really good question. So one of the decisions that was made by government was to, I guess, create or add to an existing organisation, the Independent Health Pricing Authority, Hospital Pricing Authority. So legislation's before Parliament now to establish the Independent Hospital and Aged Care Pricing Authority. Just like happens with hospitals, the concept behind that would be that this new organisation or the new functions in the existing organisation would have it look at the weightings associated with AN-ACC, so all the NWAL values that I just went through. So they would potentially make recommendations based upon costing studies and other research that they do on those NWAL values and other aspects of the AN-ACC model.
Right. Thank you very much. How often, Alex asks, how often could a facility's required care minutes be changed? And he notes that this will impact on the forward planning of rosters.
Yeah, good question. So look, care minutes will be monitored on a quarterly basis, so on the previous quarter. So depending upon how your, I guess, case mix is changing from quarter to quarter would impact your care minute targets. So it will all depend upon, I guess, the outflow and the inflow, I guess, of the residents that you have and their associated classifications.
Thanks. I've got a question for Angela as well. The timeframes are tight. What if we don't meet the June deadlines in updating the software?
So for the payment statements, it will mean for providers that they may not be able to correctly reconcile their payment statements if those changes aren't made for June.
Thank you. One back again for Mark. Are the reclassifications done by external parties?
Yes, they are. The 6 assessment management organisations and the 300 odd assessors that I mentioned would also be undertaking the reclassifications.
Where are we? How will we know whether our facilities are in a regional and which regional or remote classification?
Yeah, good question. So look, there's that's all based upon the modified Monash model, or Triple M. I think that's publicly available. So that relates to, I guess, geographic location. There are other factors at play around the base care tariffs, and that's whether or not you're a specialised residential aged care service, for example, providing care services to Indigenous or homeless people. There's some policy that still needs to be set in that regard. We'll probably be looking at releasing that and setting up some application processes for those types of base care tariffs around the middle of the year, once again, well before October.
Yeah, thanks. And we might check that we've got the details on the Triple M classifications available through our website.
Sure.
I'd be surprised if we didn't, but it's certainly worth double checking because obviously it's pretty important. Now, one for Jess. Are small home care providers also required to submit general purpose financial reports? Jess, you're on mute, or something's gone wrong with mine.
I've been doing so well, sorry. Good question on home care providers providing general purpose financial reports. If you currently submit a general purpose financial report in the ACFR, that will continue. However, if you're not required to currently provide one, you will not need to. In regards to small home care providers, I will take some advice on that and come back to this group as well.
Yeah, thanks. Does this financial reporting requirement replace any existing reporting requirements, Jess?
At this point, no, because we will be capturing a different time period. So the aged care financial report will be reporting through until June this year, and the quarterly financial report will then pick up the July through to September. Once we've done the 4-quarter collections through to 2023, things like the care minutes, which have been provided over the 4 quarters, and the income statements that have been provided over the 4 quarters could consolidate, so they don't need to be reported again. But for the first year, those 2 reports will remain.
Thanks, Jess. Mark, back to a couple on ANAC. So Hui asks, what are the reassessment timeframes? How quickly can the assessors visit, and will the reassessments be backdated?
I'll start with the last part of that question first. So yes, they would be backdated. I might need to do a fact check on this, but I think we endeavour to do the reclassifications within 28 days. But I'd need to check on that. In the shadow assessment period, once we have price and assessment information released, that will be a little bit different, depending upon the timing of the release of that information. If it happens before we've finished all the assessments, the initial assessments would take priority. But once we go live, I guess, with ANAC from the 1st of October, I think it's about 28 days, but as I said, I'd have to check on that. So wouldn't want to be quoted.
Thanks very much. Michael asks, who are the independent parties?
So there's 6 assessment management organisations. I'm sorry, Michael. I don't remember the names of all 6 off the top of my head. Once again, I think that information is probably available on our website. But look, if it's not, that's something that we can add on our website.
Yep. So I could scramble and grab something off the back of my bookshelf too, Michael. But good question. Apparently, so that they're organisations. So they're professional organisations. Aged care assessment organisations specialise in it. So New South Wales Department of Health has a body. ACNA is one of our assessment organisations, and there are a range of others. So that would give you a bit of a feel for who's in the field.
And Nick, maybe to add to that, if you don't mind. So I don't know if this partly goes to the question, but our assessors need to have certain clinical qualifications. So the physiotherapists, occupational therapists, or registered nurses. They're required to have 5 years experience in the field before they can undertake assessments. They sit a training course around ANAC assessments, utilising a standard tool. They sit an exam at the end of that training course to go, and as part of that exam, the pass mark's 80%. So look, there's lots of, apart from the quality that I mentioned before, analytics that we're undertaking, the assessors themselves are required to undergo or have certain qualifications and undergo lots of training.
Yep.
Nick, I might just jump in. I have an answer to one of the questions I was checking earlier around whether small home care providers are required to submit a general purpose financial report. So the answer is no, not unless that home care provider, but by the sound of the question, it doesn't sound like it applied to the situation. If they also delivered residential aged care, they would, but home care providers are not required to.
Okay, thanks, Jess. And Alan was asking, just while you've got the stage, how long after each quarter is the report due?
Thanks, Alan. This is one of the areas of feedback we received from the sector. We had proposed 21 days after the end of each quarter and heard that would be really challenging. So we're looking at what that time frame should or could reasonably be for providers, and also looking at other requirements that providers have around that time, things like BAS, GST reporting, all of those sorts of things. So that will be reported by us at the same time that we release the report, release the template.
And Salia asked, do we still file the 21-22 June year end results by the 31st of October 22?
Correct.
Excellent. I hope I read that out right to get it right. All right. There was a question from Panita about whether the webinar will be recorded, and yes, it is. It will be, and it will be available on our website. Now, there was a couple of questions about the monthly care statement that people have asked, which I hadn't put to the panel because we actually don't have the people with us that can talk about the monthly care statement, but you can expect to see some communications about that very soon. I know it's been discussed by people, but we're just not the people working directly on that, so I don't want to kind of give you a bit of information that seems right to me in my head, but actually ends up being misleading and doesn't help anyone. So but there will be communications very soon about the monthly care statement. Now, Michael asked, is there a process for updating funding once someone becomes palliative? So this is another one back to Mark.
Yeah, so I think that's classification 13, and part of the reclassification process is if there's a change in mobility. So yes, you would be able to seek a reclassification once someone becomes palliative.
Anne was commenting that she hasn't had a shadow visit yet and wanted to know when will this occur.
Good question, Anne. Look, hopefully very shortly. As I said, we're trying to get all the assessments done by the end of June of this year. So hopefully in the next few months, you'll have someone contacting you.
Cameron asks, has the legislation for the ANACC been passed? I might have a stab at that one too. No, Cameron. It's causing Mark and I to get very anxious. So it is in Parliament, and there are sitting days left before the budget. So we are working to get it considered by Parliament, and we're hopeful that'll occur. You know, this is, as everybody knows, this is a kind of pretty busy time of both the year and the election cycle for our political masters. If there are problems, then there are other chances before October to have the legislation passed. So we're pretty confident that we'll have legislative backing for the scheme, but we still have to do a bit of work on that. All right. So a lot of ANAC questions. I will try to make sure that we give an opportunity to Angela and Jess to kind of participate in the conversation as well, but we'll go to a few more of the, if that's what they want, we'll go to a few more questions for Mark. So so there's a question for Karenita. Sorry, I've got that name wrong. But and she states reclassifications are to be within 21 days. What happens if a resident deceases prior to the assessor attending the care community?
Well, we can't. The funding would stay the same if they were to pass away before we get there to undertake a reclassification. We would have no basis on which to change the classification for those, I guess, 3 weeks or 4 weeks.
And remember, there are a lot of classifications, reclassifications going on, and to some degree, ANAC will get a fair result, despite there being some individual cases that we can't get the right assessment done. So we've got to think of it at a system level. How often can you ask for a reassessment in the ANACC model?
So that's, once again, good question. So the specifics, I think, are classification 2 to classification 8 is 6 months. So there's a time frame. I mentioned those time frames before. 9 to 13 are 12 months. Oh, sorry, the other way around. 2 to 8 is 2 to 8 is 12 months, and 9 to 13 is 6 months. And then there's mobility changes as well. So if a resident's mobility shifts, for example, from independent to assisted mobility, then a facility can seek a reclassification. And the other one is if the resident has gone into hospital. So once they come out of hospital, a facility can seek a reclassification.
Malta asks, to what extent will facilities get insight into the classification assessments made by external assessors, and to what extent will those assessors require access to data stored in the facility's care system?
So through the My Aged Care Provider portal, facilities will have access to the classification results for all their residents. You won't have access to, I guess, the individual results that make up part of that assessment. You'll have access to the outcome of the assessment, so what classification a resident has been put into. As part of the assessment process, an assessor would look to, I guess, get access to medical information associated with the resident. So yes, that's part of the assessment process.
Sorry, I'm just losing track of myself. So there's a more general question from Byrne, which I think is probably worth reflecting on it, and Mark, I think you've covered this. The question is, are assessors independent when they're contracted by the government? Well, I think, well, I'll let Mark answer. I might have some things to add about that, because I think it's an important one for us to pause on.
Yes, so they're not government employees. They're employed by other organisations. We're not out there doing the assessments with those independent assessors. Yes, they undertake a standard training course and they utilise a standard tool, but the assessors are out there undertaking those independent assessments, as I said, without anyone from the Department of Health or anyone else in government participating in that exercise. Our role, I guess, after the event is to ensure that there's consistency and accuracy in those assessment outcomes, and that goes to the quality assurance process. So that's what we do. We have a look at the data that's submitted, and as I mentioned, we have Taylor Fry go through that data so that we can be confident that the assessments are being undertaken consistently and accurately. But we don't participate in the assessment process itself, I think is the key point.
Yeah, no, I think that covers the issues. I mean, what the department in particular and the government want to see are accurate and, as Mark said, consistent assessments done in accordance with the tools and legislation and guidance to assessors. That's the main thrust of these reforms, why we want to get to where we are. Now, there was a comment that most of our round one assessments were completed in May last year, and that the facility that made this comment is concerned that they will not be relevant in October.
So look, that's definitely where you'd be able to seek a reclassification under the conditions that I mentioned before. So when government does decide to release that assessment information, you'll have an opportunity to ask for a reclassification for those residents where you think the time period that's lapsed would require reclassification or a reassessment.
Thanks. Zoe asked, will information be provided on how the price for one NWOW is determined?
Well, I can tell you now how I guess the price would be determined. We have a funding bucket now under ANAC that I went through as part of the presentation. So that involves existing ACFI funding. It involves a $10 per day per resident basic daily fee. I think that's $3.2 billion. It involves the existing supplements that I went through, and also the care minutes funding as well, the $3.9 billion. We then have a look. We have a pretty good understanding of the base care tariffs that would apply to each residential aged care facility. As I went through as part of the shadow assessment update, we have a large number of assessments that have also been undertaken. So we have a good sense of the case mix across residential aged care, using, I guess, the total funding available in ANAC and our understanding around the fixed costs and the variable costs across the sector. We can determine or come up with a price. So that's how government would be looking at it or determining a price.
Okay. We'll get advice from the Independent Hospital and Aged Care Pricing Authority over time about the price, and there'll be some public processes around the frameworks and data methodologies that they use to determine the price as well as we go on.
That's a really good point, Nick. So I think that's a big change for the sector that it probably should recognise. Previously, residential aged care funding has been indexed with a standard value or a standard indexation rate. Once legislation passes and those independent costing assessments and pricing recommendations can be made to government, that's where the true costs for residential aged care can be taken into account moving forward.
Adrian asks, is there an appeal process if a provider believes the assessment is incorrect?
Yes, it's similar to the reclassification. Basically, a facility can request another classification if they believe that the assessment outcome is incorrect. And once again, a different independent assessor would go out and undertake an assessment.
Now, Joe asked I think what's actually quite a complex question. Mark and I might both have a crack at this. In part, I'll leave this time to give Mark a bit of a rest. We did finish the presentations early, and we've got till 2 o'clock. So most of them are on ANAC, and I think what we should do, to be fair to the community here who's asking a lot of questions, is we'll just keep pitching until we get to 2 o'clock and see how we go. We're not going to get through all the questions, but I think it's transparent. I can't limit it. We are getting questions in, so we'll go to the end of the time that we've got available to us. Okay, so to go to Joe's question, I think this is actually quite a complex question, Joe. I'll just read it out so Mark can have a think about what he'd like to say. So the comment is that we would never wait 4 weeks to implement interventions to address decline or clinical changes. So why could we not consider a desktop application to achieve promoter funding? I think it means prompter funding to support immediate change needs. And I think a couple of things that come to my mind, Joe, in thinking about that question, and Mike might have some additional points. Firstly, don't think of ANAC like ACFI. So ANAC gives for each resident a fair amount of money, and it doesn't tie to specific interventions. So under ACFI, the questions were created a line of sight from the funding question to the intervention. So if someone's needs changed, then you had to change the funding that they provided. ANAC is a case mix system which gives providers a lot more flexibility about how they intervene to support their residents, noting, of course, that it was implemented in the context where the Royal Commission put in a requirement that there be, on average, across the sector, 200 minutes of care per resident per day. So if someone's needs change, then actually ANAC has in it the flexibility for providers to immediately change their needs. So that's the first part of the answer. So it's not a funding system that is meant to directly govern the types of interventions that you provide. And this is the area where the department and the allied health profession are having sort of ongoing discussions about how all that works. I think the second aspect to Joe's question is that if the change in needs is such that there needs to be a change in the funding classification, then once that assessment's been done and that's been determined to be right, then the payment is backdated to the time that the assessment was requested. I don't know. I think it's an interesting question to pause on, Mark, because it goes to how ANAC is different to ACFI. Is there some other points that I've kind of missed or need to be corrected if I've got them wrong alternatively?
No, I think that was the perfect answer. I completely agree with everything you said.
All right, good. So Sinead asks, so does that not mean that you would still have to have ACFI assessors to know when a reclassification or incorrect classification would be required? I think the answer to that is no. We're not expecting ACFI assessments to continue.
Right.
But one of the things that is different to ANAC, so ACFI was designed so that the funding questions led naturally to a care plan. And at the time that it was introduced, more than a decade ago, that was one of the reforms that was wanted to achieve. I suspect that it's not as directly relevant now. But ANAC is not designed to lead directly to a care plan. It's designed to get the right funding to the resident and therefore to the facility. And so providers will need to have their own assessments to lead to a care plan that's about the care that they provide to that resident. So I think that's part of the answer that Sinead might be thinking of there. Mark, again for you, how is the ANACC assessment process triggered for admissions?
I'm not too sure, actually, Nick, how that works from a system point of view. I think something is fed through maybe from the Services Australia system to health when someone comes into care, so that we're aware of the fact that we need to go and do an assessment. But I'm not exactly sure how that all works, to be frank.
Okay, no, that's fair. So we'll possibly just make a note and tidy up that very practical systems guideline about how to trigger for an assessment organisation to come out and visit your facility when you've got new residents. That's a perfectly legitimate question. All right, Cynthia asks, if the consumer improves and is likely to need a lower classification, is there a positive obligation for the provider to seek reclassification?
So that's a really good question. No, the provider doesn't have to seek a reclassification, and we see that as, I guess, one of the positives or benefits of the ANAC model over ACFI. It does encourage restorative care because of the reason that was just identified. So in particular, going back to one of the questions I think we had earlier on around allied health, that's where we think there's inbuilt incentives under ANAC to provide restorative care, physio or whatever it might be in terms of the resident's needs. And a reclassification is not required if lower care is needed as a result of that restorative care.
So we see that as one of the significant advantages of ANAC to encourage that sort of restorative care. Vicky asked, we noted that she has a new facility opening in June 22 with new admissions from June to September 22. And she's wanting to understand how they'll be assessed. I think I might have given you the how do I notify for assessments question again. So, but anyway,
yeah, look, I don't know exactly how, but they will pop up on our radar, and we will undertake assessments, I guess. We'll be undertaking shadow assessments all the way up to the end of September. In this case, so even though we're trying to get all existing facilities and residents completed by the end of June, yes, there'll be new facilities, there'll be new residents on an ongoing basis. Shadow assessments will be undertaken all the way up to the 1st of October. And then when we go live in October, we'll continue with those ANAC assessments for new residents and new facilities.
Right, so we do need to come back with some more detail about the mechanics of it. That would just now, Tim asked, does the adjustment component also apply for residents moving between different facilities?
That's a really good question. I'd want to take that one on notice rather than guessing, Nick, if that's okay.
Yeah. So thanks for the questions. There are some that are very detailed about the kind of mechanics of administration, which actually pleases me, Mark, because it shows you're grappling with it. But you are talking to two people whose heads sometimes can be in the clouds. Well, me at least. Mark's more practical than I am. So we will reflect on what more kind of practical guidance we need to provide about administration with our Services Australia colleagues. And Angela, chip in if you know the answer, and you can Mark are flailing about without being able to answer. All right. So Jenny asks, so residents are not assessed for funding prior to entry. I think we have dealt with that. So no, they are assessed for funding when they are in the facility. And noting that one of the first payments is the adjustment component, given that we understand that residents' needs can be, when they first enter, can be unpredictable and usually high before they settle. Jenny, the ACAT process or this new assessment system process for determining that someone is eligible to enter residential aged care will still continue. So to get access to funding in a facility, a person will have to be assessed by an ACAT as requiring residential aged care, as is the case at present. So I've dealt with some of these. I just need to scroll down. There was a question about ACFI reporting needing to continue, and the questioner has heard that ACFI reporting will need to continue for 2 more years and wanted to understand if that was correct.
I'd have to take that on notice too, Nick. This might sound bad, but it's a little bit like those monthly assessments. ACFI's not in my space, so look, I'd have to take that on notice and consult with some other people in the Department of Health.
We'll come back and clarify that. To the extent that ACFI reporting, we will still want to check that, claims in the past have been made as we would if ACFI had continued. So we will still have some checking processes around that, but we'll just come back and clarify that. So Kim asked, so forgive me, Mark, if I've asked this, but asked how often can you ask for a reassessment in the ANACC model, noting that aged care residents' health conditions and care needs can change multiple times towards the end of their lives?
So I think maybe the key, so there's 3 conditions that I went through, but the key one in relation to that question would be mobility. So if someone's independently mobile, for example, and then they go to assisted mobility, you can ask for a reassessment on that basis.
Matt asked, can you just confirm that the 200 minutes is RN, EN and personal care workers and not lifestyle staff?
That's correct. So, and that's consistent with the Royal Commission recommendation that those 3 professions are part of the 200 minutes.
There was a question about how is funding for residential respite determined, noting that they may only stay at a facility for 2 weeks, and therefore an ANACC assessment may not have occurred.
So yeah, with respite funding, the facility, this is a slightly different process, and I don't have all the details, to be frank, I guess, available, but it's a slightly different process for respite. When someone enters care and they're entering care for respite services, that's class 1, and as part of that process, a facility would have to submit documentation to the Department of Health, I guess identifying what the respite care plan is, and some other bits and pieces as part of the eligibility criteria, and we would pay on based upon classification 1. So if someone comes in and they're already in respite care, that's where the facility would submit information and we would pay on that basis, and there's no independent assessment.
So ACATs will assess towards the, like they do with eligibility to receive residential aged care, ACATs will assess whether a person is eligible to get residential respite care, and as part of that assessment, they will also look at the classification that would apply to that person using some structured tools. So that's that won't be done by the ANAC assessors. Emil asked, will there be a penalty applied to providers if they have requested a reclassification but the ANACC classification has not changed?
Sorry, Nick, I missed that. Could you repeat that?
Sorry. Yeah, so both Mark and I are kind of feeling a bit punch drunk from all the questions. So we're both just needing to concentrate to keep onto your questions. So It was, will there be a penalty that applies to providers if they have requested a reclassification, but the classification doesn't change?
No.
So Chris Austin asked, and I think we've dealt with this in past, but it is an important question. We might, at the risk of repeating ourselves, just deal with this question. Will providers need to change some of their assessment tools they use to fall into line with the ANACC? And I think this goes to a question we dealt with in past about the difference between ACFI and ANAC. So providers won't be doing the funding assessment anymore for ANACC funding. That'll be done by the assessment organisations. We understand, we've talked to some of the services market that help facilities with their claiming, and we understand that some of them are advising the use of tools to get a feel for what the person would be entitled to. That's not a formal part of the process, but I don't think that we think that it's harmful. And we have published what tools we would be using, but they're not actually required. You know, in theory, a provider could just wait for an assessor to come and determine the classification. But the other side of the answer to that question is that providers will need to start thinking about how to produce a care plan in the absence of the ACFI funding instrument. So providers will need to be prepared to have their systems in place to once a person is entered, to develop a care plan for that person, because that won't be required. That won't naturally flow from ACFI anymore. Is there anything you'd like to add to that, Mark?
No.
Excellent. Now, Melanie asked, does the 200-minute relate to direct care only, or does it include time spent documenting the person's records and referrals?
So that's a really good question. Once again, it's quite, I guess, detailed and technical. I guess this is where we need to accurately define what's part of direct care, and we are in the process of doing that. So, I mean, if someone is consulting with a GP, if someone's, I guess, discussing issues with family and so forth, that's all considered direct care. The records itself too, on that basis, I would have thought would be included as part of direct care. But yes, that's a good question. We're trying to define the details of all of that because we know it's important for the sector.
Yeah. So Helen asks, for residents who arrive in a facility just prior to the 1st of October, will they require an ACFI or will they be automatically assessed under ANAC? And so I think the first part of that is, well, for the period before the 1st of October, there will need to be an ACFI assessment.
Yep.
And for the part after October, then there will obviously need to be an ANAC assessment, and that there'll be a process that will describe to you better and more fully about how to commission that that will then govern their funding from the 1st of October. Tracy noted that if a resident is admitted and has not been initially assessed and then dies, for example, 5 days after admission, what classification will they be deemed and backdated for? Noting that that's not a reclassification.
That's a good question. Look, I'm not too sure in that circumstance, I guess, what the classification would be. I'd assume they would have entered on the basis of palliative care and therefore would be classification 1. But I guess that wouldn't be the circumstance in all situations.
We'll need to do some guidance on that. So it may be if they weren't admitted on palliative care that the adjustment payment is the payment that covers that period before assessment. But that's a good question, Tracy, and we'll come back to you on that detail. I think Sorry, just on the questions that are in front of me, we've run out, which I think is unlikely given that all questions is about 200. So we've got 1 minute to go. So Helena asked for a transcript of the questions answered directly in the chat. There will be a recording of the facility, but in addition, we've undertaken to provide some additional information out of this. And so I think, they're all fair questions. And we'll provide some additional Q&As, I think, coming out of this. That's I'm responding in part to Cameron's comment that these are real issues we need answers to. And as I said, as Mark and I said when we were answering them, yes, we're actually quite delighted that we've got to this level of detail. And we'll come back to you quickly with some more practical guidance about how this will all work. I think we've actually got to 2 o'clock and well, we didn't get to the end of your questions, so we didn't think that we would. As I said, we'll reflect on them and come back with some more detailed Q&As. But at that time, I think it's probably time for me to thank everybody who's still on. We're actually delighted to see that always the test. There are 2 tests in these, well, 3 tests in these things. The first is how many people came and registered, and there were a lot, but that shows interest. The second is how many questions you asked, so it was nearly 300. So that's a fantastic hit rate for the people that are determined, because we do actually appreciate these questions, even if we couldn't answer all of them, but actually that's good. And the third is how many people are left after you've stopped speaking. So it's really disheartening to see when you start speaking that there are less people than when you finished, and there's still 700 people on the call at the moment, which we're actually very happy with as well. So on that positive note, we'll end the webinar. Thanks very much for Mark, Angela and Jess, in particular Mark, who had to shoulder a lot of the questions, and thank you everybody who's participated.